Have you ever found yourself in an intimate moment, reaching that peak of pleasure, feeling that familiar intensity, only to realize that something was missing? The feeling was there, the climax was real, but the physical evidence you've been accustomed to your entire life was either greatly reduced or completely absent. This experience has a name. It's commonly known as a dry orgasm or dry ejaculation. And the first time it happens, it can be unsettling. The second time, it can be downright worrying. It can plant a seed of doubt, a quiet anxiety that you might not even feel comfortable sharing with your partner. It's a topic often shrouded in silence, but it's far more common than you might believe. You might find yourself asking a flood of questions. What's wrong with me? Is this just a part of getting older? Am I losing my virility? My masculinity? Let me be clear right now. These are completely normal questions, but the answers are probably not what you fear. In almost every case, this has absolutely nothing to do with your manhood or your ability to experience profound pleasure. In this video, we're going to pull back the curtain on this deeply personal topic. We are going to explore the real, science-backed reasons why this happens, particularly for men over 60. We will separate the widespread myths from the straightforward medical facts. And most importantly, we will outline the practical solutions and simple steps you can take, not just to understand what's happening within your body, but to regain your peace of mind and your confidence. Everything we're about to discuss is grounded in established medical understanding and extensive research. Let's start by decoding what's really going on. To truly understand dry ejaculation, we first need to get one critical fact straight, and it's the most important concept we'll cover. For your entire life, you've likely thought of orgasm and ejaculation as the same single event. But medically speaking, they are two separate processes that are beautifully synchronized to happen together. First, let's talk about the orgasm itself. An orgasm is a neurological event. It's a wave of intense pleasure, a sensation that is orchestrated entirely by your brain and your central nervous system. It's a complex cascade of neurochemical signals that creates that unmistakable feeling of release and euphoria. Think of it as the command center in your head giving the signal for the grand finale. Ejaculation, on the other hand, is a physical, mechanical process. It's a bodily reflex involving a series of muscle contractions designed to do one thing: expel semen from the body through the urethra. This is the delivery system, the physical action that typically accompanies the neurological sensation. Here's the best way to visualize it. Think of a massive fireworks display. The orgasm is the spectacular, breathtaking burst of light and color that silently explodes across the night sky. It's the visual masterpiece, the sensory experience itself. The ejaculation is the deep, resonant boom, the sound wave that follows, confirming the event with physical force. For most of your life, you've seen the brilliant light and heard the powerful boom at the exact same moment, creating one seamless experience. Dry ejaculation is simply a situation where you see that incredible, brilliant display of light in the sky, the orgasm, but the accompanying boom is either silent or very quiet. The key thing to remember is this: the absence of the sound does not make the light show any less real or spectacular. The pleasure you feel, the orgasm, is just as real and just as valid. Your body's ability to experience that peak pleasure is not broken. Now let's look at the mechanical reasons why that boom might go silent. So, if the orgasm is happening but the ejaculation isn't, where does the fluid go? To answer that, let's explore the single most common cause of dry ejaculation in men over 60, a condition called retrograde ejaculation. This might sound like a complicated medical term, but the concept is surprisingly simple. Imagine your urinary tract is like a highway system with a critical intersection. Semen travels down one road, and at the climax, it reaches a junction. One path leads forward, out through the penis. This is the normal route. The other path leads backward into the bladder. At that intersection, there's a small, powerful muscular gate called the bladder neck sphincter. In a normal ejaculation, just before the climax, this gate is supposed to slam shut. This action effectively blocks the path to the bladder and forces all the semen to travel forward, taking the only open exit. In retrograde ejaculation, That little gate doesn't close properly. It remains partially or fully open. So, when the powerful contractions of ejaculation occur, the semen, following the path of least resistance, is pushed backward into the much larger space of the bladder instead of forward and out. The orgasm happens, the contractions happen, but the fluid takes an unintended detour. It's a plumbing issue, not a performance issue. So, why does this gate suddenly stop working correctly? There are three main reasons. First, and most significantly, are surgeries involving the prostate. Procedures like the transurethral resection of the prostate, or TRP, which is a very common surgery for an enlarged prostate, often involve removing tissue right near that muscular gate. Sometimes, this can permanently damage the muscle or the nerves that control it, preventing it from closing tightly ever again. It's a very common and expected side effect of such procedures. The second major cause is medication. Many men over 60 are on medications for other health conditions, and some of these can directly affect the bladder neck muscle. Alpha blockers, which are frequently prescribed for high blood pressure or to treat the symptoms of an enlarged prostate itself, are designed to relax muscles to improve flow. Unfortunately, they can't always distinguish between the muscles you want relaxed and the one you need to contract during climax. Certain antidepressants and other medications can have a similar effect. Third are underlying medical conditions that cause nerve damage. Uncontrolled, long-term diabetes is a primary example. Over time, high blood sugar can damage the delicate nerves throughout the body, including the ones that send the signal for the bladder neck to close. Neurological conditions like multiple sclerosis or spinal cord injuries can also interfere with this nerve signaling. Now, here's the key piece of evidence that can often point to retrograde ejaculation, noticing that your urine is cloudy or milky the first time you urinate after having an orgasm. This is simply the expelled semen mixing with the urine in your bladder. It's completely harmless and will be passed out of your body naturally. Let's consider the story of Robert, a 65-year-old retired history teacher. A few months after undergoing a successful surgery for an enlarged prostate, he and his wife became intimate again. He was thrilled that the pleasure of his orgasm felt as strong as ever, but he was deeply confused and then distressed when almost nothing came out. He didn't say anything to his wife, but a profound sense of brokenness began to set in. He felt a secret shame, worried that a fundamental part of him had been taken away. He started to avoid intimacy, creating a distance his wife couldn't understand. Finally, he sought medical advice. When the urologist explained the simple mechanics of retrograde ejaculation as an expected outcome of his surgery, Robert described the feeling as an immense weight lifting from his shoulders. His virility was intact. His body was simply working differently. Understanding this simple mechanical fact saved his confidence and his marriage. While retrograde ejaculation is the most frequent culprit, it's not the only one. The second major cause is what we can call a blockage in the path, medically known as ejaculatory duct obstruction. If retrograde ejaculation is a problem at the highway intersection, this is like a roadblock on the main highway itself. Let's go back to our plumbing analogy. The semen is produced in the testicles and stored in nearby structures. When ejaculation begins, it travels through a series of tiny, intricate tubes called the ejaculatory ducts to mix with fluids from the prostate and seminal vesicles before being expelled. These ducts are incredibly small and can, under certain circumstances, become blocked. When this happens, even if the bladder neck gate is working perfectly, the fluid simply can't get through to the urethra. This results in a very low volume of ejaculate, or sometimes none at all. What could possibly block these tiny ducts? There are a few common causes. One is scarring from past infections. A man who had a significant case of prostatitis, inflammation of the prostate gland, or other urinary tract infections in his past might have developed scar tissue. Over time, this scar tissue can build up and narrow or completely close off these delicate passages. This is often a very gradual process, with a man noticing a slow decline in volume over many years, not a sudden change. Another cause can be the presence of cysts or tiny stones, known as calculi, that form within the ducts. Just like a kidney stone can block the flow of urine, a seminal calculus can create a physical barrier that obstructs the flow of semen. These are less common, but they're a known cause of obstruction. Unlike retrograde ejaculation, where the orgasm feels completely normal, a duct obstruction can sometimes be accompanied by other symptoms. Some men report a feeling of pressure, a dull ache in the pelvic region, or even a sense of pain or discomfort during or immediately after orgasm. This makes sense. The body is trying to forcefully push fluid through a blocked tube, which can cause pressure and pain. Let's imagine the case of David, a 68-year-old engineer. For years, he had been quietly troubled by a noticeable decrease in his ejaculation volume, but he chalked it up to just getting older. More recently, though, he began experiencing a strange, deep ache in his pelvis after being intimate with his wife. The pleasure of the orgasm was immediately followed by this nagging discomfort. The combination of low volume and new pain finally prompted him to see a specialist. An ultrasound revealed a small cyst that was pressing on one of his ejaculatory ducts, creating a partial blockage. A minimally invasive procedure was performed to drain the cyst, and within a few weeks, David was astonished to find that not only was the pain gone, but his ejaculation volume had returned to what it had been years earlier. For him, the issue wasn't an inevitable part of aging. It was a specific, solvable mechanical problem. His story is a powerful reminder that changes in our bodies, even ones we might dismiss, often have clear medical explanations. We've discussed a plumbing detour and a plumbing blockage. Now let's talk about the third common cause, which we can think of as a problem with the factory's production line itself: hormonal imbalance, specifically low levels of testosterone. Testosterone is the master hormone for male sexual health. Think of it as the CEO and the chief engineer of the entire operation. It doesn't just drive your libido or sex drive, it plays a fundamental role in the production of semen. The testicles and seminal vesicles, the primary factories for sperm and seminal fluid, rely on adequate levels of testosterone to function efficiently. When testosterone levels begin to decline significantly, a condition known as hypogonadism, it's like a factory experiencing a major power brownout. The assembly lines slow down and production volume drops. The body simply doesn't receive the strong hormonal signal it needs to produce a robust amount of seminal fluid. This leads directly to a noticeable decrease in the volume of the ejaculate. In severe cases of testosterone deficiency, the volume can become so low that it appears to be a dry orgasm. This cause is different from the previous two because it's often not an isolated symptom. A drop in testosterone significant enough to affect ejaculation volume rarely happens in a vacuum. It almost always brings along other telltale signs. Men experiencing this often report a general feeling of fatigue or lethargy that they can't shake. Their energy levels are just chronically low. They might notice a significant drop in their libido. Their interest in sex isn't what it used to be. They might also experience changes in mood, increased irritability, or even find it more difficult to achieve and maintain strong erections. It's the combination of these symptoms, low volume plus low energy, low libido, and weaker erections, that often points toward a hormonal issue. It's crucial to understand that this is not a personal failing or a psychological problem. It is a treatable medical condition. It's not just the way it is after 60. Let's consider the story of Michael, a 62-year-old small business owner. For the better part of a year, he felt like he was running on empty. He was tired all the time, his enthusiasm for life had dimmed, and his once healthy sex drive had all but vanished. During the rare times he and his wife were intimate, he noticed his orgasms were weak and produced very little fluid. He felt old, washed up, and disconnected from his own body. He assumed this was simply the inevitable downhill slide of aging. His wife, however, encouraged him to get a full physical, including a blood test. The results were clear. His testosterone levels were far below the normal range for his age. His doctor started him on a carefully monitored testosterone replacement therapy. Over the next few months, the transformation was remarkable. His energy returned, his mood lifted, his libido came back, and, to his great satisfaction, so did the volume of his ejaculation. He hadn't been aging. His body's hormonal engine had just been running low on fuel. Now that you understand the common medical reasons behind changes in ejaculation, from physical detours to hormonal shifts, I want to introduce another layer to this. What if many of these issues, and erectile performance in general, are powerfully influenced by a hidden root cause that most mainstream solutions completely ignore? Scientists have identified a specific boner killer enzyme in the body that actively sabotages blood flow and firmness, forcing men to rely on temporary, and often dangerous, pills. But what they also discovered is a bizarrely simple, all-natural home remedy that can restore rock-hard, youthful erections by targeting this enzyme directly. It's a powerful method some are calling the purple hardening tonic, and it works in just a few seconds a day. I've linked a special, free video presentation that explains exactly what this is and how thousands of men are using it to completely rescue their sex lives. To watch it right now, simply open your phone's camera and point it at the QR code you see on your screen. For those watching on a mobile device, there is also a link pinned at the very top of the comments section. Go ahead and do that now, and then we will continue. Now, while the three causes we've discussed, retrograde ejaculation, duct obstruction, and hormonal imbalance, account for the vast majority of cases and are generally not dangerous, there are certain situations where a change in ejaculation is a signal that requires immediate medical attention. Think of these as the red flag warnings your body can send. It's important to know them, not to create fear, but to empower you to act wisely and swiftly when necessary. So, let's be very direct. You should see a urologist or your primary care physician right away if you experience any of the following. First, a very sudden and complete onset of dry ejaculation that is not related to a new medication or recent surgery. If things were completely normal last week and this week there is absolutely nothing, it's worth getting checked out promptly to rule out any acute neurological or obstructive issues. Second, pain. A normal orgasm should be pleasurable, not painful. If your dry orgasms are consistently accompanied by significant pain or a deep, throbbing ache in your pelvis, testicles, or perineum, this is a clear signal that something is wrong. It could indicate a severe infection, inflammation, or a significant blockage. Third, the presence of blood. If you notice blood in your urine after an orgasm, or if your ejaculate itself, if any is present, is tinged with red or brown, this is never normal. While it can sometimes be caused by a benign issue like an inflamed prostate, it can also be a sign of more serious conditions, and it must be evaluated by a doctor. Fourth, constitutional symptoms. If your dry ejaculation is accompanied by unexplained fever, chills, or night sweats, this could point to a serious underlying infection in your urinary tract or prostate that requires immediate treatment with antibiotics. And finally, neurological changes. If the onset of dry ejaculation happens at the same time as new weakness in your legs, numbness or tingling in your genital area, or a sudden loss of bladder or bowel control, this could be a sign of a serious spinal or neurological issue that requires urgent medical intervention. Again, these scenarios are the exception, not the rule. But in the landscape of your health, knowledge is your most powerful tool. Knowing when to be concerned is just as important as knowing when to be reassured. Ignoring these specific red flags is not an option. So, after exploring the mechanics, the causes, and the warning signs, what is the key takeaway? It's that dry ejaculation is almost always a condition with a clear medical explanation, not a verdict on your vitality. It is not the end of your intimate life, nor is it a reflection of your masculinity. It is simply a signal from your body that something has changed, and the power lies in understanding that signal. Let's distill everything we've learned into a simple, 3-step action plan that you can start today to take back control of your health and confidence. Step 1. Break the silence. The most important step you can take is to talk to a professional. Schedule an appointment with a urologist or your primary care doctor. Be open and honest about what you're experiencing. They've heard it all before, and they can start the process of diagnosis, whether it's a simple urine analysis after climax to check for retrograde ejaculation, a blood test to check your hormone levels, or an ultrasound to look for obstructions. This single conversation is the bridge from anxiety to answers. Step 2. manage your overall health. Many of the underlying causes, like nerve damage from diabetes or the need for blood pressure medications, are directly linked to your broader health. Taking control of chronic conditions is not just good for your heart or your blood sugar, it's essential for your sexual health too. A well-managed body is a better functioning body in every respect. Step 3. Support your body with a healthy lifestyle. This is the foundation upon which everything else is built. Regular exercise, like brisk walking, improves blood flow to every part of your body. A diet rich in antioxidants, found in foods like tomatoes, nuts, and leafy greens, helps protect your vascular and prostatic health. These aren't magic cures, but they create the optimal environment for your body to function at its best. Ultimately, understanding what's happening inside your body is the first and most critical step toward a confident and fulfilling intimate life at any age. The pleasure, the desire, and the profound connection with your partner are not defined by volume. They are defined by your health, your confidence, and your willingness to seek answers. If this video has brought you some clarity or hope, please give it a thumbs up. Share it with a friend or a loved one who might be quietly worrying about this very issue. And be sure to subscribe for more straightforward, no-nonsense content on how to not just age, but to thrive after 60.